trimester, the mom usually experiences breast tenderness, nausea, a lot of fatigue. The baby really grows quickly. You're starting to form arm and leg buds. The baby starts to move. And you typically see a heartbeat by ultrasound between 5 and 6 weeks. At 20 weeks, the baby weighs between 11 and 12 ounces, and it's 8 to 10 inches long. At that time, between 16 and 20 weeks, you can tell the sex of the baby, and the babies are sucking. They are moving around really well at that time. They may turn over several times a day. Their fingernails start to grow to the end of their little skin at that point. Their brain develops rapidly. Also, the moms start feeling them move. In first pregnancy, sometimes it's 20 weeks, but women who have had babies in the past can usually feel them around 18 weeks. So moms are starting to experience that first exciting movement that you have. We check all the anatomy on the scan at 20 weeks to make sure everything looks normal. We check their heart, kidneys, bladder, make sure they can swallow, look at their lip, all those things. By 36 weeks, the babies usually turn face down in the pelvis to get ready for labor. They start practicing breathing. They really aren't taking in breaths, but they're moving their chest up and down to practice for when they're born. You start to see hair on the head of the baby when you're doing ultrasounds and can tell if they're going to have any hair. Their weight can increase by ½ a pound a week in the last month of pregnancy. So the baby's really, their brain function is already developed and they're starting to put on weight and get ready to be born. They really start looking more like a mature baby because they're starting to fill out and that. Detectable by ultrasound at 5 or 6 weeks, and with a Doppler around 8 to 10 weeks. It keeps getting earlier all the time. Now babies can survive in the NICU between 23 and 24 weeks with the right intervention. So it's really come a long way with that. First time moms around 20 weeks, and moms who've already had a baby, sometimes between 16 and 18, but typically by 18 weeks in a mom who's had a pregnancy already. Typically morning sickness subsides by 12 weeks. There are some women that are stricken with it throughout the pregnancy, but as a general rule, it's by 12 weeks. The tests that are run during pregnancy are blood tests. We always need to know the mom's blood type just to make sure that if the baby's Rh negative, we would be aware of that. We check for STDs in pregnancy. We also check a test that's called an alpha-fetoprotein to check for neural tube defects in babies, to check for Down syndrome in babies also. So, and then of course ultrasound. We typically do 2 ultrasounds, an early one to date the pregnancy, and then an anatomy screen between 18 and 20 weeks. Those are the most common.